Good afternoon, colleagues, and welcome to session 11C of this joint CQUIN and South-South Learning Network workshop on differentiated service delivery models for sex workers. I would like to ask, as we begin the session, if Andrea will just talk us briefly through some of the housekeeping for the session, and we'll then get going.
Hi all. So as you know, with this webinar, we do have simultaneous English, French, and Portuguese interpretation. To manage your interpretation settings, just at the bottom of your screen, if you can see the little globe icon, you can select the language of your choice. And if at any time you wish to switch over, you can manage those settings, but you will not be able to hear your language unless you've selected interpretation. That's all.
Thanks so much, Andrea. So just a emphasis, please, if you are English speaking, select the English language, as we have a French speaking panelist, and you won't be able to hear the English translation unless you select the English language. So colleagues, my name is Kerry Mangold. I'm the Program Director of the South to South HIV Prevention Learning Network, and I'm very happy to welcome you to this penultimate session of this very intensive but really rich workshop that is run virtually since last week, Wednesday. I'm really excited about this session specifically because it provides the opportunity to focus on sex workers and consider key barriers and solutions to effective implementation of differentiated service delivery. We have, over a number of days, listened to some incredible presentations and panelists, but now's the time where we can engage and deliberate and discuss on some of the items that have been brought up through the remainder of the workshop. I look forward to introducing you to our host for the session. Perhaps on the next slide, thank you. So our host for the session today is Felicita Abdallah. Felicita is the National Coordinator of the Kenya Sex Workers Alliance. She's a single mother of 3 and an active sex worker living with HIV for the last 11 years. The Kenya Sex Workers Alliance is a network of over 60 sex worker-led organizations that has built strong partnerships, strengthened access to legal, health, and human rights services, and worked with members to develop a strategic plan with a new vision, mission, and goals. Throughout her life, Felicita has focused her energy toward the inclusive participation of sex workers in planning, decision-making, and implementation of programs. And with that, I'd like to warmly welcome and hand over the floor to Felicita to guide us through this, hopefully very interactive and interesting panel discussion. Thank you, Felicita.
I'm unable to start my video, but it's okay. Thank you so much for the hot introductions. I'm so happy today I'm going to be your moderator. I have been introduced, you know who I am. So one of the things I would like to make it clear as a moderator is the fact that there is translation ongoing. So if you can look under your screen, you will see where there's mute, start video, participation, screenshots, raise your hand if you have any question. Then there's something that is written English. If you're not an English speaker, or it's written language. So if you're an English speaker, change to English. If you're a French speaker, change to French. And if you're a Portuguese speaker, please turn it to Portuguese. In case of anything, please let us know in the chat box. So today we are also going to be joined by a panel. And we are going to have panel from different countries. We are going to have Zintle, Sholwana. We are going to have Kabayanga Grace, we are going to have Modeste Mambo Hamisi and Fatuma Idi. We will be introducing our panelists when they will be doing their presentations that they have prepared to present to us into this panel today. Is this the moment where the hosts are introducing themselves?
Lister, would you like to do the first poll at this point?
Okay. So today we are also going to have polls. We are going to have different polls. We have the first, the second, and the third. So this is the moment where we introduce the first poll. So once we open the poll, you are going to be given an opportunity so that you can be able to vote for the answer that you think is the correct answer. Then after this, we shall be able, this is going to be like a 1 minute introduction. Then after this, we shall screen the results of the poll. And the first poll is, what do you believe is the greatest barrier to funding and implementing impactful sex workers program in Africa? What do you believe is the greatest barrier to funding and implementing impactful sex workers programs in Africa? So give us your correct answer. The poll has been aired. You can see it in your screen. Please give us your response. Yay. If you check into your screens, then you'll see we have the results of the poll. I think the one that has gotten 82%, the highest vote from people, 18 people out of 22, is legal and policy environment. Consequences of COVID actually has 0%. Reliance of donor funding has 14%. Environmental factors, conflicts, 0%. Others specify in the inbox chat. So in case of anything, but we have 5% on that. Okay, so I think from this, I'll just take us straight to the history of how the African movement started in Africa. How the sex workers movement came to start. So sex workers existed in Africa and in varying forms from pre-colonial time and up to now. So sex work during colonialism. I'll talk about the story of Kenya. I think there was this old sex worker in Kenya who used to tell us, she's owning one of the brothels here. And she told us that during the colonial, they actually used to sleep with the colonial people so that they can be able to steal information and take it back to the freedom fighters so that they can be prepared for the information that they are going to any attack that was coming. At colonial economy grew, and as the 20th centuries, war efforts development, as I have told you, Africa male migrants were drawn to urban towns, military settlements, and minimum camps, which increased opportunity for African women to engage as sex workers, form individuals and family labor. So this was kind of a labor that women used to do so that they can be able to sustain their families. Sex work in a colonial period also achieved increased economic and social autonomy by becoming independent heads of households, sending money back to their rural families and accumulating wealth by labor, migration, and globalization. So in 2009, to make the short story fake, we had 153 delegates who came across 10 African countries, to Johannesburg, me being one of the delegates who also attended the first ever sex workers conference that was held in Johannesburg, supported by Sweat. Sweat was the one that hosted that conference by then. The conference brought together sex workers organization, advocates, supporters from across Eastern, Western, and Southern Africa to share their knowledge and expertise on specific sex work issues that cut across the continent. So I think one of them was we wanted to get a clear definition and understanding of sex work. How do we really want to be known? What is the terminology that we want people to refer us to? And that's where we approved and we said we would like to be known as sex workers. Then we also we spoke about stigma and discrimination of sex work and human rights. We also spoke about criminalization and structural violence. We also spoke about access to healthcare services and facilities and diversity representation and collectivization. The conference took best approach to sex workers issues and advocates that all sex workers are human beings or human rights defenders. From the start of the 3-day conference, and tone was clear. We want rights and not rescue. So it was very clear coming from us, the sex workers, what we wanted was right, not rescue. Citing Africa political liberation movement as a source of inspiration, the conference culminated in the formation of the African Sex Workers Alliance, that is ASWA. So immediately from there, we started having discussions of starting the African Hub or the African Regional Network, and that is where the idea of ASWA came through. So ASWA is a movement or a network established to empower sex workers, leaders, activists, and organizations who support the rights of sex workers and publicly denounce the stigma and discrimination and criminalization of sex work. ASWA is a growing alliance of sex workers and sex workers partners seeking to contribute to social, economic justice for sex workers in Africa. Its vision is an empowered sex work industry where sex workers have equal. ASWA strives to create an enabling environment of partnerships that enable sex workers to address the complexities, dynamics, and diversities within the sex work industry. Today at this session, we are proud to have representative of the African Sex Workers Alliance and sex workers in Africa. So, karibuni sana, welcome. And that is the history we have of Africa here today. So now we are going to the introduction of the panelists. We have Zikle Shoalna, is the advocacy officer of Sisonke National Movement of Sex Workers. She is a Rhodes University alumni with a Bachelor of Arts, Law, and English Literature, as well as an honor of degree. She is also a feminist who fully believes in the decriminalization of sex work, as well as protecting the human rights of all vulnerable key population. We have Grace Kabayanga, is the executive director of the Empowered at Dusk Women's Association. She is a female sex worker who is very passionate about human rights and activist as well. Then we have Modeste Mambo, is a human rights activist and defender for 10 years. He's an epidemiology and executive director of HOSDA, a structural based and a non-promotional of health, rights, and protection of sex workers and sexual minorities and in the Democratic Republic of Congo. Modeste is a former board member of the African Sex Workers Alliance, ASWA, and a current member of the co-founder of the West and Central Africa Coalition of Sex Workers. He is also a member and a co-founder of the Congolese Human Rights Alliance Sex Work Project. Modeste is a trainer and a mentor in several initiatives and organizations in key population in French-speaking African countries. Then we have Fatma Idi, is the national coordinator of the Feminist Initiative, South Sudan, the only sex workers-led organization in South Sudan, statistician by profession, with 6 years of experience in sex workers' rights and sex workers' rights activism that has yielded better environment for sex workers in South Sudan. So at this moment, I'm going to invite Zinle, who have just read her bio, so that she can be able to take us through and reflect on the criminalization of sex work as a key barrier towards the implementation of different service delivery for sex workers. Welcome,
Thank you
Zinle.
very much. Thank you so much, Calista, and a warm welcome and a warm hello to the other panelists as well as the participants. Yes, so my name is Zinhle Cholwana, and I am representing the Sisonke National Sex Workers Movement. So just to start with my opening statement, I think it's very interesting the results of the first poll question, where majority of us will have said that the law and policy seems to be the greatest barrier. So what I'm going to just quickly do is just to outline the 4 legal approaches to sex work. So I'd like you to just think of them as a spectrum, right? So starting at criminalization, okay, and then going into, so starting at criminalization and then ending at decriminalization. So the first legal approach is the current one that is adopted in South Africa, which is criminalization. So in essence, criminalization is where sex work is criminalized. It's in its entirety. So this includes sex workers, the selling of sex. It also criminalizes the buying of sex. And in South Africa in particular, under our law, it also criminalizes benefiting off the proceeds of sex work. So for example, you know, if a sex worker has dependents that they support through sex work, by benefiting from that income is also a criminal act. Now, obviously, criminalization is a very, very oppressive legal stance because it has devastating effects. Criminalization, it also just echoes the long-standing stigma and discrimination against sex workers, as well as everybody else around the sex work industry. And one of the results is that it does force sex workers underground. Now, by underground, I mean operating obviously within the fringes of the law. And so sex workers don't have a lot of legal recourse if they do encounter police brutality or abuse or any kind of violence from clients or from brothel owners, etc. And also with the stigma that comes with criminalization, sex workers are also discriminated against in healthcare facilities, which is a major barrier to accessing treatment, because if a sex worker has to encounter ridicule and stigma in healthcare facilities on a regular basis, then they really aren't motivated to go back to health facilities, naturally, because they don't want to have to face that kind of ridicule. So then that also will affect adherence to treatments as well as access to treatment. Now, the second legal approach is called partial criminalization. So it's partial because it doesn't criminalize sex workers, but it still criminalizes the buying of sex, and it also criminalizes brothel owners and other people within the sex work industry. So obviously, when clients are now criminalized, any abuse that clients perpetrate against sex workers, it seems to be a lot more violent from what we found, because it's a criminal activity. It's sort of an underground kind of activity. And it still doesn't protect sex workers' rights. So even though the act itself, the act of selling sex, is not criminalized, but the effects of it are still quite brutal, and they are still quite similar to full criminalization. All right, and the next one here is legalization. Now, with legalization, sex work is regarded as legal under the law, but there are special laws and other requirements, such as licensing for brothels and sex workers, that are put in place. Now, on the surface, that does seem like a good approach, because it provides regulations in terms of the industry, and it also provides regulations in terms of health services, as well as engagement with the police. Now, one key aspect of these policies would be forced health tests that sex workers would have to undergo under this legal approach. And once again, if we look at it from a human rights perspective, it takes away the agency of sex workers. Okay, and then also under this legal approach, sex work wouldn't be considered a normal job under South African law, for example. So sex workers would not have any protection under labor law. So we can see it affects human rights, but it also affects us in terms of labor law. Okay, and then the fourth legal approach is decriminalization. Full decriminalization, which is what we are advocating for. Now, full decriminalization is the only rights-based approach to sex work. All right, and we say it's a rights-based approach because it recognizes sex work as between consenting adults. Sorry. And it's also viewed as an occupation, just like any other legal occupation. Now, through full decriminalization, sex workers have the agency to conduct their work in the safest way for them. Through full decriminalization, sex workers can form unions, they can form labor unions, and then they'd be able to use the labor law to protect themselves against abuse, against any types of discrimination that they would have faced before. And another thing with decriminalization, it does tackle, or it's the first step rather, to tackling stigma and discrimination, because of course, changing the law is not enough. But once sex work is recognized as an occupation, as a legal occupation, and then that can start to change the mindsets of people, because it's not a criminal act anymore. And so then they can consider how sex work is a legitimate occupation, and more importantly, how to protect sex workers as they conduct their work. So I would like to go into the second poll question that we have, based on the definitions of the 4 legal frameworks that I've just explained now. So the question we have is, given the definitions of the different legal approaches to sex work, which do you think is the most enabling of scale up to impactful sex worker programs? And I'd like to end it there for now. Thank you very much.
Thank you very much. Thank you very much, Zintle. So we are in our second poll. Please take your time to vote for your answer. Zile has already read the question. So if you can, the poll is actually on your screen. If you can vote for your answer. So please, the poll is out. If you have seen it on your screen, give your feedback, vote now. This is the time for people to vote for their to give in their responses for the poll. As we are doing that, after presentations, if you have any questions, any feedback, we have a Q&A box which is located. Please give your questions and they're going to be responded to. The responses are on your screen. Look at them. Very interesting.
Yeah, this is quite interesting, actually.
Yeah, very interesting. We've seen that the full decree was actually won.
That's awesome. I'm also very interested in the second most popular answer, which would be legalization. I mean, so I'm in the Q&A session, but I do know that there are some arguments for legalization, just in terms of tackling the healthcare issues. So if you have policies that address healthcare, even if it's a forced policy, it can sometimes be argued that would be a better option.
Thank you, Sinclair, for that. Let's wait to see what the participants are going to tell us, but it's very clear. But I think it's also interesting. Would really want to know from the people who have voted for full legalization, any comments that are coming from you. We have a Q&A box. Please drop your comments, drop your questions so that we can have this as a discussion together. So with this, thank you very much, Zile. Thank you for everybody who has taken their time to vote in for their answer, and we got the results. And here again, we are welcoming Grace Kabayanga, Executive Director of Empowered at Dusk Women's, so that she can be able to consider the impact of COVID-19 on implementation of differentiated service delivery for sex workers, the impact of sex workers and possible solutions using the Ugandan example where she comes from. Welcome, Grace. The floor is yours.
Thank you so much, Modeste, for giving me this opportunity. I'm Kabayanga Grace, Executive Director, Empowered at Dusk Women's Association from Uganda. I'm an active female sex worker and alumni from SWA Academy, and I'm glad to be on this panel. And My topic is on the challenges of COVID-19 towards sex workers service delivery. During the year 2020, early 2020, World Health Organization announced or declared COVID-19 an outbreak, which is really an acute stressor that has caused the trauma, destabilization of individuals and countries. According to the Ugandan context, in order to curb down the pandemic, Ugandan government suggested different measures, which included total lockdown. This saw restrictions in movement. It saw closure of hotspots, bars, 24 hours, no movement of even pedestrians. Since this COVID-19 significantly reduced sex workers' access to services and crucial health materials. This saw interruptions in the supply of health equipment such as condoms, PrEP, even art. And you know what it means when interruptions in medicine happens. This increases the viral load for HIV positive clients, hence increasing spread of the epidemic. You know, countries, especially Uganda and others, tended to ignore HIV and streamlined COVID-19. They put COVID-19 on as number one, not knowing that once you ignore HIV, we are going back to the deaths that we are having even more in the past. COVID-19 saw HIV positive sex workers or clients not adhering due to lack of nutrition. Many sex workers report facing hunger as their source of income were striped out. As I told you at the beginning, COVID-19, due to governments to curb down the epidemic, it led to closure of brothels, hotspots where sex workers carry out business from, massage parlors, travel bans, and even curfew hours. So, since sex work is the only income for us as sex workers, so we failed to get food for our people and even our families. There was even inaccess assured onto information on health and rights, as well as SRHR services like contraceptives, safe abortion practices, even HIV practices. This was due to the fact that many sex workers, we are operating drop-in centers, and these drop-in centers are the safe spaces where sex workers could come and gather. So due to the lockdown, which led to ban of social gatherings and even the roadblocks that were put on the way by the police, this hindered sex workers from coming for services at drop-in centers, thereby interrupting their health chain supply of treatment. Another thing that led to COVID-19 has really increased the gender-based violence and sexual violence among sex workers. This is shown due to the fact that now sex trade is being done underground. And if it's done underground, it's not like in the past where we would go on the streets, in the lodges, on the massage parlors for safer sex, but now these sex workers are doing it in hide, and even culprits
Grace,
or
have we lost
nowhere to report. You have lost me.
Sorry, we
Hello?
had lost you for a second, but you are back now. Continue, please. Sorry.
Sorry. So you may find that people are doing sex work underground, and the culprits that are raping sex workers and even causing violence on sex workers are not put to book. Now I may give an example of clients and intimate clients of sex workers. They've really caused sexual violence and harm to sex workers. On top of the violence caused by intimate partners and our clients, we are facing brutal arrests by the police in this guise of enforcing SOPs or standard operating procedures. Like last year, this year in May, 117 sex workers were arrested here in Uganda in a period of 2 weeks. And they are being extorted money from by these police officers. So we are really facing a lot of marginalization and really inequalities due to COVID-19. We are also, CSOs are unable to provide personal protective equipment to peers who work as community health extension workers. And the government has really failed to provide these PPEs. So you find the sex workers are not receiving services as they were before COVID-19. Since here in Uganda, mostly we are using the peer model mostly. So our peers are not, they can't go far minus being protected. So that also hinders services to sex workers. Even there is outreaches and prevention activities were hampered with due to restrictions. Since the other time before COVID-19, we are having the HIV testing face-to-face and counseling and even psychosocial support. So members were not able to get or are not able to get these services during this corona pandemic. And you'll find that we have no safe spaces or shelters to maybe keep those who have undergone mental health issues, mental health problems, or violence. So that's also a major problem. Even the program operations delayed for sex work organizations who are having programs to implement, partners could not fund. They needed to the funds were reallocated. So you find that we really lacked services during this time due to Corona. Allow me to talk about the possible solutions that we have so far done to avert the situation. Most sex work organizations and individuals have really done a lot. Some have got support from outside or from our partners to support members in food, especially for those who are on art, have been provided with some food, and also home deliveries of health consumables and art, and also PrEP. Members have been dropped medicine for 3 months, so as they can adhere very well. And another thing we've also done is tele-counseling. Members have, sex work-led organizations have really done a lot in tele-counseling, especially to members who are really stressed up, especially those on art and PrEP. They've also...
Grace, you have 1 minute to wrap up.
Okay, and also we've also done a mobile refuge using the DIC motorcycle to really see to it that these clients who are in hotspots or anywhere in long distances have been delivered with the services. I think I'm done.
Thank you very much, Grace. Thank you. I think this is very interesting. I've seen that the scenario is actually reflecting many different places and countries. It's actually kind of the same scenario here in Kenya when it comes to the COVID and service delivery. So at this time, this is where we launch our third poll. But before we do that, so the poll is up on your screens. Please take a look at it. As your country, government, or law enforcement taken any repressive measures in response to COVID-19 aimed directly at sex workers? Choose any of your answers. Polite reminder that we have a Q&A box. Please ask your question. I have seen that the Q&A box is a bit busy and we have people who are giving responses to it. Please, if you are also a presenter, you are presented here, just take a look if there's a question that is directed to you and see if you can be able to chat it out. Then at the end of the other presenters, we shall give an opportunity for interactions and responding to the questions. Please respond to the poll. The poll is on your screens right now. Take a look at it and give us your answer. Let's make use of the question, the Q&A box. Let's make it very interactive so that we can be able to respond to any questions that you have. They say sex workers are experts too. You can hear the more information that we're sharing here, the work that has been done on the ground. Just use the Q&A box so that we are able to respond to it. There is our response. Very interesting. The closure of brothels and bars has actually won, and the massage parlors. And this was really, really challenging for us as sex workers. This was quite complicated for us to operate since our working areas were actually closed down. Yeah, increased monitoring. Yeah. Thank you very much for your response. And with this is taking us to our next presenter, my very good friend Modeste Mambo Hamesi from DRC. If Modeste, you can talk about funding gaps and donor resilience for sex workers program funding and how this is key barrier to scale up and differentiated service delivery for sex workers program implementation and impacts. I'm sorry, I'm reading the question in English, but a polite reminder, there's translation that is happening. Modeste, 5 minutes, then please, if we can keep on time so that we have time for questions and answers.
Oui. Bon après-midi, Félicite, et bon après-midi à tous les participants, les panélistes aussi. C'est un plaisir pour nous de participer à ces échanges très importants pour les structures, mais aussi nous, les acteurs clés. Moi, c'est Modeste Mambo.
Sorry, Modeste,
je suis le directeur exécutif des Hommes pour les droits et la santé sexuelle. Et aussi
Modeste,
membre...
sorry. 1 minute, Modeste. My channel is in English and I can still hear Modeste in French. My channel is in English. I can still hear Modeste speaking French.
Hi, everyone. So just as a reminder, if you've switched to English or Portuguese translation, you in the settings, you can mute the original audio and you will not be able to hear Modeste speaking in his original language. Thanks, everyone.
Continue, Modeste. Please mute the the original audio, mute original audio so that you can hear Modeste's translation. Modeste, go ahead. Modeste, can you hear
Merci
us?
beaucoup. J'espère que là, vous me suivez correctement. C'est bon.
Modeste, are you there?
C'est déjà bon. Aux grandes rencontres pour des acteurs clés pour échanger. Moi, je vous entends. Oui, je suis là. Moi... Ok, est-ce que je peux parler? Allô?
Hi,
Yes,
Modeste,
welcome back,
your
Modeste.
connection is
Welcome back.
very poor.
Go ahead.
Let's just give us a chance to test it.
Ok, merci beaucoup. Moi, c'est Modeste Mambouamissi. Je suis le directeur exécutif des Hommes pour les droits et la santé sexuelle, une structure qui focalise son action dans la promotion des droits à la santé et à la protection des travailleurs de sexe dans un contexte difficile dans l'Est et la République du Congo. Il nous a été demandé qu'on parle un peu de la CQUIN de financement et de la dépendance des donateurs pour le financement des programmes de travailleurs de sexe et de la manière dont cela constitue un obstacle majeur à la mise en œuvre et à l'impact des programmes de travail de sexe à l'échelle et de manière différenciée. Je vais donner un petit contexte général. Pour nous, en fait, il y a environ 10 ans. Il y a environ 10 ans depuis la mise en place des seuls fonds spécifiques au travail de sexe. Nous citons Red Umbrella Fund. Évidemment, à l'issue de la rencontre Sex Worker Festival, où Feminist a participé, et moi aussi nous avions participé en 2012. Et à l'issue de cette rencontre, il y a eu le fonds qualifié de Red Umbrella Fund, le fonds qui est spécifique pour les populations de travailleurs de sexe. Mais depuis 2012, il n'y a jamais eu de fonds spécifiques aux travailleurs de sexe. Certains bailleurs préfèrent partager des fonds à plusieurs organisations avec des sommes minimes pour soi-disant avoir un impact diversifié, mais l'impact n'est pas durable. De la dépendance des donateurs pour le financement des programmes de travail de sexe. Ne recevant pas des subventions des États, des organisations, les structures, les organisations de travail de sexe et les structures comme des initiatives, ni même des agences des Nations Unies et internationales, les organisations de travail de sexe se contentent des financements
organizations of sex workers only bank on well wishes.
Ils se contentent de financement
are just satisfied with some
malheureusement,
partners
les
who support
financements
them.
sont parfois
Unfortunately,
minimes. Quand je parle de
this
minimes,
financing is very minimal.
entre plusieurs organisations.
That means that
peut
the
envoyer
funds are
20
shared
$
across
pour
many
les
organizations.
on les divise
For example,
dans 10-15 structures,
$1,000
partenaires,
for
et c'est ce fonds.
10,
On
15
donne soit 1000 ou 500 par
organizations.
structure. Malheureusement,
that is
c'est ce que nous disons que c'est le financement
1,700 per
parfois minime,
health center.
mais ces financements
And
aussi
these
sont parfois
funds
ponctuels.
are
Ponctuels, c'est-à-dire une
difficult.
fois l'an, par exemple, parfois étalés par tranche
Once
sur
a year,
une
for
période
example.
longue. Et enfin, ces financements est parfois partiel, ne prennent pas en compte les besoins spécifiques tels que les dépenses administratives, le loyer, les frais Internet, salaire des staffs. Moins sont ceux-là les bailleurs ou donataires qui financent ou accompagnent des propositions en rapport avec les renforcements des capacités des organisations, la gestion financière et administrative, dans la mobilisation des ressources, dans l'implémentation des activités et un impact pérenne, mais surtout, moins sont ceux-là des partenaires ou des bailleurs de fonds qui financent des organisations de travailleurs de sexe et des actifs pour renforcer l'autonomie financière des organisations. C'est-à-dire des activités génératrices de revenus pour renforcer l'autonomie financière des organisations. C'est d'ailleurs le lieu de remercier la mise en place de l'académie. C'est l'université
setting up of an academy, the university which is for sex workers at Nairobi, which builds capacity for various sex workers in Africa
au centre et ouest Afrique.
they come from Central and West Africa. And this, for us, is an activity that has enabled a number of organizations or groups of sex workers to be equipped with knowledge to put in place new modalities for their work. So as a consequence now, first, due to lack of financing, with selected structures, these organizations for sex workers don't have sufficient means to run their activities, and so they are very dependent. Certain groups are even closing down.
Surtout durant cette période de pandémie à COVID-19,
especially certain centers have closed their doors during this COVID period. In Central and West Africa, they are closed because they don't even have the means to pay rent, to support their activities, and they don't even have the means to take care of their staff. Unfortunately, the finances or the donors are also selecting and scaling down their activities during this COVID season. And when we talk of specific needs, for example, the fight against HIV, these activities are scaled down because of the COVID
on a du mal à retrouver des vraies structures, des structures, des organisations qui sont vraiment
really a lot of difficulty in finding proper structures
il y a aussi apparition de plusieurs structures opportunistes
qui commencent à se présenter several other opportunistic groups that are coming up.
Managériales, mais ne défendent pas la cause,
but they are not really defending the cause.
Comme recommandation,
as a recommendation, with regard to,
nous recommandons que le travail de sexe soit le travail de sexe, les activités, les structures, les organisations puissent être au centre de la lutte contre le sida. C'est-à-dire que les programmes
that means that the programs should be programs and structures that are present on the ground.
Ce sont des programmes qui sont l'émanation des besoins spécifiques du travail de sexe au niveau des terrains en matière de lutte contre le sida. Ce ne sont pas des programmes que les bailleurs de fonds proposent, mais ce sont des programmes que les organisations proposent parce que c'est un besoin spécifique.
These should be programs proposed by the sex workers groups.
Nous recommandons aussi que les bailleurs de fonds puissent privilégier le financement durable basé sur le renforcement de l'autonomisation des organisations. C'est-à-dire accompagner les structures à mettre en place des activités génératrices de revenus pour soutenir leurs actions à long terme.
Income generating activities so that they can, in a long term, support their activities.
Par rapport au management,
with regard to co-management as well,
cela fait que durant cette période de la pandémie à COVID-19,
during this COVID-19 period, a number of organizations have closed their offices. In concluding our presentation, we will be asking everyone, we will be sharing a plan, actually a call to action, so that we can find support for groups of sex workers, and we can have an activity or activities organized, and even support legislation in Africa across various countries, in West and Central Africa, so that we can have programs that are in line with human rights. So I hope I'll be able to respond to all your responses. Thank you very much for your kind attention.
Thank you very much, Modeste, for that. Yeah, I think it's very realistic and it reflects different countries in Africa when it comes to resources. The space is shrinking, and this is the conversation we should be having because we are still criminalized in our own countries and the space is shrinking. So what is the way forward? Polite reminder just to tell you that the Q&A box is open. Please ask your question. If you have any question, use the Q&A box and your question is going to be responded to. And we are also going to get, if time allows us, we're also going to discuss those questions here. So this one takes us to Fatma Edie from South Sudan. Fatma, please, if you can tell us about the experience of sex workers in South Sudan and how being in a fragile conflict country affected is a barrier to the implementation of scale and comprehensive sex workers programs.
Thank you, Felista.
Modeste, please, if you can mute. Modeste, please mute your microphone. Welcome, Fatma. Please, you have 5 minutes.
Thank you. All right, thank you. My name is Fatma Idi. I'm the National Coordinator for Feminist Initiative South Sudan. It's the only sex worker-led organization in South Sudan. I'm also a radical feminist and also the co-coordinator for the East African Sex Workers Alliance. The population of sex workers in South Sudan is estimated at 13,000. That is a program estimate, size estimate that was done in 2016. So up to now, we estimate the size estimate might be up to around 25,000 sex workers in South Sudan. So the package of services that we receive as sex workers in South Sudan is HIV testing services, the family planning, STI screening and treatment, GBV screening and support, condom promotion and distribution. This is offered by Global Fund and PEPFAR, but these services would have reached worker-led organizations who are engaged, and if not engaged, they were fully engaged, because our programs as sex workers would be better if at all we were fully engaged. So through support of peer educators that have been trained by the organizations that implement this work, the organizations that are not sex worker-led organizations, we have reached 2,500 sex workers only out of the original 13,000. And up to now, we estimate to be around 24 to 25,000 sex workers in the whole country. But we have only reached, the documented number is 2,500 sex workers who are identified and are active on ART in South Sudan. But with the current situation of conflicts in some parts of the country and the current political situation, which is not stable, the sex workers that are fully reached with services are the ones in the capital, which is Juba. So through coordination and collaboration with the Ministry of Health, the South Sudan AIDS Commission, the UNAIDS, and the Network of AIDS Service Organization, advocacy on sex workers have been held on high leadership as part of enabling environment for sex workers service provision. This advocacy is still going on, but we have not yet reached the result we really need to reach. And South Sudan as a young nation and still with conflict affected situations, most of the towns or most of the states in South Sudan the STI screening, the HIV testing, but it's only Juba that received this. Most of these towns would run up to 6 months to 8 months without receiving services, like for example ART, especially except some of the states that are in contact with us, and we have we collaborate with Intra Health South Sudan, and with these calls we will have to send ARTs and sometimes come from Juba to these other towns. But with the towns that are not in close contact with us and with Intra Health South Sudan, they will take that great number of treatment. Then they're hindering access to services to the sex workers. For example, the unlawful crackdowns on hotspots and homes, which includes rape of sex workers by uniformed personnel and some forcefully tested. For example, in these crackdowns, sometimes when there's crackdowns, sex workers will be arrested, and when they are taken to the police stations, they are forcefully tested, and when they find you positive, they'll make sure that you go to prison with the claim that you are the one spreading HIV. Just 3 days back, 3 ladies in a hotspot, they had issues like customer wrangles, and at the end of the day, they ended up fighting. So when they were taken to the custody, the 2 ladies, they were tested forcefully, and one of them who was positive, she was a migrant sex worker.
Moderator, would the speaker speak into her microphone? We have problems getting her. From interpretation, we can't get her.
Fatma, we can't hear you. You are so far away from your microphone. I don't know if it's the network or something.
Okay, let me try to speak a bit louder. Can you hear me now?
It is pretty okay now.
You can hear me now,
please.
All right, thank you. All right,
yes,
thank you.
Go ahead.
So I was saying, well, with the high levels of human rights violations on sex workers has become the greatest barrier hindering access to services. So we have the unlawful crackdown. Sometimes I will just decide today we'll crack down on sex workers, arrest, because at the end of the day, they'll get, this has really hindered access to services in one way, that sometimes sex workers who are I think, I'm not sure, maybe it's the network. So you can get me now?
Yes, we can get you. 1 minute to finish.
Okay, so forcefully testing sex workers, and when you're tested positive, they'll use your result as a basis for persecution and taking sex workers to prison. There's also a high level of stigma and discrimination from healthcare providers, community leaders. Has also led to many sex workers not to go to health facilities to get healthcare services with fear of being discriminated and so isolated. Hence, they decide to stay in their hotspots and homes. If we as the sex worker-led organization do not get the medicines and reach them with the ART and other services. So we advocate, we are still advocating on continuous sensitization discussion with leadership as a part of enabling environment creation to reduce unprecedented arrests of sex workers, extortion of money, and use of condoms as evidence of sex work when arrested. So with this, sex workers fear to move with condoms because once you're arrested with a condom, they use this condom as evidence of sex work. And sometimes they'll make a sex worker to swallow the condom, which is so inhuman. We also encourage the donor world to advance funds for sex worker-led organizations for appropriate utilization on activity implementation with key focus on target and reach on the intended beneficiaries. We also advocate for the inclusion of sex workers in planning and implementation of activities meant for sex workers, not only used to bake the cake, but when it comes to eating the cake, sex workers are left out. We really want to bake the cake and eat it as well. So we say there is nothing for us without us. Thank you.
Fatma, you done?
Yes, I'm done. Thank you.
Thank you very much, Fatma. I think it's a very hard situation to work in a conflict country. Very complicated and very difficult. So I can't say I understand your experience because I'm not in a conflict country. But even us in the countries that we're in, which are not conflicted, and we're still facing a lot of challenges. So thank you very much for that presentation. So actually, this is taking us to our other to our other questions and answers. And this is the time where we want people to, if you have any Q&A, please use the box, type your questions so that they can be able to be responded to. We have active people who are actually here to respond to your questions. Thank you very much for the people who have given out their questions. I will read 1 or 2 questions out. So Zitlem, there is a question here which you have responded to about the cream. If you can elaborate more on the cream, just I think in 1 second, if you can be able to tell us, elaborate a little bit on the cream.
Okay, sure. So when we talk about full decriminalization, what we mean is that sex work, so the selling of sex, the buying of sex, keeping a brothel, benefiting from the income of sex work, those would be decriminalized. So they wouldn't be considered as a criminal act. So the really important thing with full decriminalization, as I said, it's a rights-based approach. But it also allows the regulation of other aspects of sex work. So decriminalization would be the first step to tackling access to healthcare. It would be the first step to tackling stigma and discrimination. So just the important thing to remember with full decriminalization is that so the buying of sex, selling of sex, just the sex industry as a whole would not be a criminal act anymore. I hope that answers your question.
Thank you, Zintle. So I think the question was coming from Nelson Otoma. I hope it has been responded to, and to the people who did not have a clear understanding on it. So there was another question in the Q&A for people who have not come in to visit the Q&A. It's still open. Please type in your questions and you're going to get your responses. But there's a question of if there are any examples of places or countries that have decriminalized sex work. How has this affected HIV epidemic in those places? So I think I will read the answer from Charles from the African Sex Workers Alliance, who says, yes, in New Zealand and other European countries, yes, research has shown decriminalization reduces violence, thus reduces HIV impact. That has come from Charles. So Zintle, if you can be able to tell us the response that you have typed in the inbox in 1 second, so that other people can be able to hear it who have not been able to visit the Q&A box.
Okay, so sure. Yes, so as Nelson had correctly pointed out, New Zealand is one of the first countries to fully decriminalize sex work. And so in relation to HIV, statistics have shown that New Zealand has one of the lowest in terms of HIV infections. They have quite low statistics. And one of the key things is that through their decriminalization, they've also developed policies that are related to safer sex practices. So I think that's also a very huge contributing factor to the HIV statistics. Thank you.
Thank you very much, Zintle. Modeste, I can see your hand is up. If you can actually come in and tell us something. And then Modeste, if you can please speak in the French channel. You are speaking in the English channel and it's making translation to be a bit complicated. Your hand is up and we are giving you 2 seconds. Modeste. I don't know if Modeste can hear us since we can't hear.
Sorry, Chair, we cannot hear the speaker at all. We have advised them to switch to the French channel. They are not doing so.
Okay. Okay, that's fine then. So we are going to go to our next question. This question was directed to you, Grace. What do you think telecounseling could replace a face-to-face counseling even after COVID as a way of to save the cost?
Thank you so much for that question, but to my You know, telecounseling, you call someone, you start counseling her or him on phone, which is not more effective than someone whom you are with face to face. Someone cries or someone really tells you your problems face to face and you counsel him or her. I think face-to-face counseling is more effective and it makes more impact to a client you are working on better than that of telecounseling. So that's all I have to say. Thank you.
Thank you very much, Grace. Yes, very complicated teleconference counseling. As people doing the work on the ground, it's quite complicated. It's quite different from having a face-to-face with people, because you don't get to see people's feeling. You don't know whether they have reflected to what you've told them. Very complicated. Thank you, Grace, with that. So Fatma, we are here with you. There's a question that says, what did you mean when you said sex workers are fully reached in the capital city? If you can tell us this.
Yes. When I said the sex workers are fully reached in the capital, with the city, I meant that they have the health services like HIV testing services, family planning, STI screening and treatment, GBV screening and support, condom promotion and distribution. Yes, that's what I meant. Thank you.
Thank you very much, Fatma. Our Q&A chat is open. Please, if you have any question, type in your question. I see that we have another question here coming from Ibrahim, asking if there are no provisions in country laws to criminalize sex work, but arrests are made for other activities at hotspots, how do we all call that? This is for you, Zintle.
All right, thank you very much for that question. So I'm going to use South Africa as an example. So even though sex work is criminalized under law, so under a statute, so it's called the Sexual Offences Amendment Act. It's very difficult to use that law practically. So sex workers are arrested based on municipal bylaws. So municipal bylaws would be public indecency, loitering. I saw Aruna in the chat box also pointed out loitering as well. So they use municipal bylaws to arrest sex workers, even though the statute is there. So I guess in other countries they would also use those municipal bylaws as the basis for arresting sex workers.
Thank you very much, Zinsley. So we have a Portuguese question, if translators can help us with this. There's somebody who asked a question, I think it's in French or Portuguese.
The question is in French. Is it the question by Boy? Is it that question that you're referring to?
Yes.
Well, I can, if you want, I can interpret, but I'm not from the French booth. I'll allow the French booth to do so.
We don't mind you translating for us.
Okay. It says, in Senegal, there is a regulation. It appears as if there is no, the sentence hasn't been completed. Perhaps.
So if you can unmute yourself and elaborate on that. So as this is happening, oh, they say it is just a statement, they believe. Okay. Okay, that's good if it's a statement. Thank you very much for that clarification. I think with this, we are coming to we are going to give each panelist at least 3 minutes, 2 to 3 minutes, so that you can give us any remark that you have, recommendations, and call to action that you have. And we have seen that the legal and policy environment became an issue of, it became the first point that really people voted on it. So if we can also touch base on that. Who are we starting with? Zentle, we have to start with you. Please give us your remarks and any call to action that you have.
All right. Thank you, Felista. Yes. So in closing, sorry, we do have, as an organization, we do have calls to action, and we are still in the process of advocating for decriminalization to the legislature, and one of the most important calls to action is in relation to law enforcement. So we want law enforcement to host or to facilitate mandatory sensitization programs within the police force. We found that the police are the almost the biggest perpetrators of violence against sex workers, and so we believe that if there is a sensitization program, a full comprehensive sensitization program, then that would also change the way that police engage with sex workers, even in a situation where sex work is criminalized. There definitely is a more humane way of engaging with sex workers, and so that is an important one for us. A second call to action that we have is for healthcare workers, and for healthcare workers, we would like the government to publicly commit to providing effective, differentiated healthcare services. This is for sex workers and other key populations. So we believe that these services should cater to the specific needs of key populations. So that is definitely an important one for us. But just in closing, it all starts with the decriminalization of sex work, and also just to actively change people's mindsets and how they think about the industry. So yes, hashtag decriminalize sex work, hashtag sex work is work. Thank you.
Thank you very much. Back to you, Grace. Hashtag decriminalize sex work.
Okay, thank you so much, Modeste. Some of the recommendations
Grace.
we can. Sorry, are you hearing me?
Yes,
Hello?
This is Felista. It's Felista speaking, not Modeste. Yes, go ahead.
Sorry, Felista, are you hearing me?
Yes, I can hear you. Go ahead.
Okay, some of the recommendations we are having not far away from my sister Zinte: sensitization of law enforcers, local leaders, and opinion leaders to stop those brutal arrests in disguise of enforcing COVID-19. They should know that even sex workers have their rights. And another thing is meaningful engagement of sex workers at all levels in policy and law formulation, such that these laws can also involve sex work issues. Another issue I can talk about is direct funding to sex work-led organizations would also solve that problem of the inequality among sex workers. Funders should initiate more initiatives, more funding on the human rights, on initiatives that advance human rights of sex workers, since sex workers' rights have been violated a lot during this pandemic. And also more funding to projects of economic empowerment, such that on top of sex workers can have an alternative source of income, such that in case of an emergency like COVID-19, they have where to get something to put in the stomach. Another thing I can urge on is that call to action is invest more resources to keep population programming. That would really make our work very easy, and it would really make our members feel good. Let's also create a dating app for female sex workers to conveniently meet and connect with their partners for convenience. The microphone back to you, Felista.
Thank you very much, Grace. This is very encouraging. So back to you, Fatma. Hashtag sex work is work. It's your time to do your closing remarks. Fatma?
Yes. Thank you, Felista. Okay, thank you, Felista. First, my first call to action is to decriminalize sex work. If at all sex work is decriminalized, we'll not be talking of human rights violations, we'll not be talking about stigma and discrimination, we'll not be talking about all these challenges. So the first thing is to decriminalize sex work, so as everything else comes to normal. Then I'll also advocate for the decentralization of services to access points that are preferred by key population, especially in countries that are conflict countries and countries that are fragile. And I would also urge donors, I would also ask donors to advance funds, direct funds to sex worker-led organizations for appropriate utilization on activity implementation that are meant for sex workers and other key populations. Hashtag sex work is work.
Thank you very much, Fatma. I can see we only have 7 minutes left. Charles, if we can give you 1 minute from the African Sex Workers Alliance, Charles, if you can give us your remark also. Thank you, Charles, the space is yours. Charles, are you there? Unmute and say something, please. Charles, since we are not hearing from you, I think one of the things that has come from my side, it's clear that the legal frameworks in different countries are similar and criminalizes sex work, creating a very hostile environment among sex workers and contributes to violence, increasing HIV prevalence. Shrinking expenses of donors' funds has been a huge barrier to community-led scale-up of different service delivery. Full decriminalization is the key actor to freedom of expression and enjoying the human rights. So with this coming from me, I want to take this opportunity to invite Kerry so that she can do a closing remark from us. I want to thank all the panelists and everyone who has joined. Thank you very much. Welcome, Kerry.
Thank you, Felista. So I just want to express my sincere thanks to our wonderful host, Felista, as well as the powerful panelists for bravely sharing their experiences and sharing barriers, including those posed by hostile legal and policy environments, barriers posed by COVID, donor dependency, and fragile and conflict-affected states. I want to end this session by challenging the audience to take up the calls to action and go back to their country teams and be change agents to support the overcoming of key barriers identified in this session today. There have been a number of recommendations and calls to action that have been put forth, and these will be available through a recording of this session. So that is my kind of challenge and closing remark to the audience. And just on a last note, since we are hashtagging, I thought I would hashtag sex work is work, hashtag decriminalize sex work, and hashtag I am we are human. Thank you, everybody. The session is now closed.